Oh, we're getting a lot of these. All right. All right. So now, same thing. We look at this question and we look at it, select all that apply. Which of the following interventions should be included in the plan of care? What type of which one of the four is this? Again, identify it as education. Yeah, absolutely. It's just education. So we got to figure out the situation. And the situation in this situation, or in this scenario, is a nurse cares for a client with ulcerative colitis who is having abdominal pain and greater than 10 plus bloody stools per day. Have we talked about ulcerative colitis? Yes. Okay. So with ulcerative colitis, what type of food is going to slow down those 10 bloody stools and diarrhea? High protein, right? The concept that I taught you was protein slows down the GI tract, and then fiber or residue will speed it up. So would we offer the client high protein foods during snack and meals? Yes. Investigate the client's compliance with medication regimen. When are you not going to ask the patient? And look at this, investigate. Could I even say, tell me if you're taking your medication. Tell me how you're taking your medication. Tell me what your dosage is. Therapeutic communication. All I'm asking you is to tell me more, right? So am I going to investigate the compliance by saying, tell me more? Absolutely, I am. Same things that I'm teaching you, just worded a little differently. So when you take a step back, why do I think I say everything? I put literally everything in my own words, right? If I'm asking compliance, I'm saying, tell me more. Tell me how you're taking medication. Tell me when you take your medication. Initiate strict intake hourly intake and output monitoring. This person is bleeding and they're having diarrhea. So you think we want to make sure that they're hydrated? Absolutely, we want to make sure that they're hydrated. So we're going to initiate. Encourage the client to discuss feelings about illness, mental health, therapy. When is therapy ever wrong? It's not. This is an example of therapy. Again, what did I do? I put it in my own words. Administer prescribed analgesic medications as needed. PRN, pain meds. All 5? Do you get nervous about all 5 being right? Not when you explained them, not when you explained it to me. There is nothing in here that I've not taught you. There's not one answer in here that I've not taught you. They're just worded differently. High protein, slow down. Tell me more. Initiate IV fluids and monitor their hydration status. Encourage therapy. Administer pain meds as needed. Tell me I've not taught you every one of these at some point. Don't be intimidated. 27% of people got this right. Don't be intimidated by select all that apply. Learn to put things in your own words and understand that, look, they just threw in a little mental health right here. Oops. Right? That's mental health. Therapy. Communicate. Journal. Therapeutic communication. Therapeutic response. Tell me more. These are all different parts of the whole course. So yeah, maybe this isn't strictly GI, but there are also things that I've taught you throughout. This is how I want you to learn. This is how I want you to study.